Patients kind of, the first thought of that is like, oh, that sounds painful. It absolutely isn't, and there may be the odd Google review on some website that might basically turn around and say, I've had a bad experience, it's painful. But all I can tell you is speak to our patients. If it's done right and it's done safely and it's done by an experienced provider like myself, it is absolutely pain-free. Okay, not every single case needs IPR, but in my experience, the majority of cases will need it. The reason being is because simply 90% of my cases involve some element of crowding. Okay, the 10%, we've got the spaces, we all know some people with gaps in between the front teeth. It can be quite a fashionable thing. Madonna very famously has had gap put in, taken out, missed it, put it back in again. But the majority of my treatments and the majority of my cases are complaining of crowding, and there's very simple reason for that, is that particularly as adults and more so with ladies, but certainly gents as well, but as you go through your 20s and your 30s, the jaw itself gets narrower, and because the jaw gets narrower but the teeth remain the same size, what tends to happen is the teeth, particularly towards the front, start to crowd up and start to cramp together, and there has to be that stress breakerage at that point, and that's when the teeth start to overlap slightly, and that's something that can in some instances continue to get worse through the 20s, 30s and even beyond. So for those 90% of cases, you kind of got to look at that situation and go, well, hang on a minute, if the jaw's got smaller but the teeth themselves have remained the same size, and that's why the crowding's occurred, something's got to change. You're not going to be able to straighten those teeth without either making, number one, the jaw bigger, and that's not something that we can do to a certain extent because we can't regrow bone and make the jaws bigger. But the other thing then is that, and this is where the fixed braces come in, usually what happens is you take a tooth out. Now we're talking about taking, in most instances, a perfectly healthy tooth out. So IPR with the Invisalign system is the third option, okay? And the third option, this IPR, is essentially where you very safely and very precisely make a number, sometimes only one or two, but make a number of teeth physically narrower within an arch. Now that might be just the bottom if the crowding's in the bottom, it might be just the top. But what tends to happen is you will take up to a maximum of 1/2 millimeter polished in between the flossing gap of a couple of anterior teeth. Sometimes we do it for the back teeth as well. And patients kind of, the first thought of that is like, oh, that sounds painful. It absolutely isn't, and there may be the odd Google review on some website that might basically turn around and say, I've had a bad experience, it's painful. But all I can tell you is speak to our patients. If it's done right and it's done safely and it's done by an experienced provider like myself, it is absolutely pain-free. I've done this to very close patients. I've done it to staff members. I've done it to my brother and sister who both had Invisalign treatment with me, and a couple of other close family and friends. But the treatment itself, the IPR, is absolutely painless. I mean, don't compare it now to having 4 teeth taken out like I had a treatment when I was a kid. I mean, again, the pain is a ridiculous comparison, but it's essentially the enamel can be up to 2 millimeters, sometimes even more thick. And when you're taking a maximum of 1/2 millimeter in between 2 teeth, that 1/2 millimeter is spread basically is 1/4 millimeter at a maximum, okay? So you're getting somewhere close to not even 10% of the enamel thickness that you're taking off. Fast forward then to looking at the other areas of the teeth where some patients grind their teeth, but even patients that don't grind their teeth and clench their teeth a lot, you still wear down a minimum of 1 to 2 millimeters on the edges of the teeth, some patients even more than that, at 10, 15, 20 years. So you look to a 30-year-old patient, for instance, they've already ground down at least 1 millimeter, if not more, on a number of different teeth. And you tell me if that makes the teeth particularly sensitive, okay? Whereas the one part of your teeth that never wear down is the flossing gaps, because when you're grinding and you're clenching, and even to an extent when you're brushing, and even if you're a hard brusher, you're not physically able to wear down that part of the tooth enamel because there's no way of getting into it and no way of those things rubbing against each other to be able to cause that. So essentially what we're doing is creating a tiniest controlled precision little bit of wear in an area that your teeth would never wear throughout your entire lifetime, to be able to line those teeth up in basically essentially a better position and a straighter position. There's also one final, in my opinion, advantage to the IPR, in that particularly for a lot of front teeth, incisor teeth are quite triangular. So when teeth are all crowded up, you have this nice sort of little, as much as the teeth are crowded, but the gums are all compressed, the pink stuff's all pressed down out of the way. When you then start to open up the teeth and you start to line up, what you're lining up is you're lining up the bite edges of your teeth essentially. We refer to them as the incisal edges or the occlusal surfaces. And the problem is in patients with quite triangular teeth, when the edges of those teeth line up, the necks of the teeth don't. And if the teeth have been crowded beforehand and the gum's already compressed, the gums will not come up and fill in that void between the wider edges at the top and the narrower necks at the bottom. And that creates a phenomenon in dentistry called black triangle. And a black triangle is basically where you smile and the gum hasn't come down to fill in the edges. So as much as the teeth are touching and lined up, it almost looks like there's a partial space through. So with the Invisalign system and the IPR, and again it's something I use quite often, in that what you can do is you can customize that IPR to polish through that triangular contact point. And by polishing through the triangular contact point, what it means is that instead of having the teeth touching at this very narrow contact point close to the edge and the bite surface of the tooth, at the smiling edge of the tooth, you can polish through it, softening the angle, and allow, using the brace system, allow that to marry closer together. In some instances, marrying it that close together and that much higher up that the gum can naturally fill in that void. Again, far superior to a fixed brace system, where you could potentially be left with fantastically straight teeth, but these little dark triangles which then, sod's law becomes the new bugbear of a patient's smile.